Hi everyone, I'm Dr. Larissa, and today I want to talk to you about a really important condition called endometriosis. Now, this is something that might affect quite a lot of women out there, and hence I wanted to make a separate video on it in order to address what the symptoms are, what the main concerns are, how it can stop you from having a baby, and essentially what you can do about it. So the first thing to say is to explain this condition to you. Endometriosis is where tissue that's supposed to line the inside of the womb, called the endometrium, is actually found in other places other than the lining. So it could be in the actual muscle of the womb, or it could be outside in other patches around the pelvis, sometimes even on your ovaries or on your tummy wall. And the main problem with this condition is that this tissue can start to get very inflamed and start to release toxins in the body, which can make you feel quite ill during menstruation and can give you pain in particular. So this is pain that starts to build from the start of your menstruation and then gets better as menstruation goes on. Or in addition, it can give you pain during intercourse, so that's during deep penetration. And sometimes it can cause pain even without menstruation occurring. So when you have quite severe symptoms, that pain can actually last throughout the entire cycle, only to be made worse by menstruation. The other thing that women quite commonly experience is bloating. And again, that's caused by some of the inflammation that's going on within the tummy. So why is this all happening? Why does it actually cause a problem in terms of the ability to get pregnant? Well, the issue with inflammation is that it can cause scarring within the pelvis. And when there's scarring, this means that potentially organs such as the ovaries and the fallopian tubes, which are quite vulnerable in there, can start to be affected. So in terms of the fallopian tubes, if there's any endometriosis there, they can start to form blockages, which can stop the egg and the sperm from meeting and from fertilizing. Also, if there's endometriosis on the ovaries, it can start to form cysts, which are fluid-filled collections. They're filled with blood, typically known as chocolate cysts, because the fluid on the inside resembles chocolate. It's brown when you puncture these or you look at them in an operation. And again, that can start to have an impact and an effect on how well the ovaries function and how good your egg reserve is, because if there's a big cyst that's occupying that area, it's almost inevitably going to compromise any of the other healthy tissue that's actually there. The other way that endometriosis can also impact on fertility is it can affect the endometrium, which is the actual lining of the womb, and this is where implantation occurs. So studies have found that in women with endometriosis, the risk of miscarriage is higher, potentially due to this. The other thing that studies have also found is that egg quality can also be affected by endometriosis, meaning that in women who have already got lower reserves because of endometriosis, they may also suffer from lower quality of eggs because of the impact that the endometriosis has on those eggs. So what tests or investigations can you do to see if you've got endometriosis or not? Well, first of all, if you've got any of the symptoms that I've mentioned earlier on, then you should be going to see your GP, who should carry out an examination and take your history and might do some blood tests, and will, of course, and should refer you for an internal ultrasound scan to have a look at the ovaries, to look at the womb, and to look at the fallopian tubes and any other surrounding structures that could give us clues as to whether endometriosis is there or not. But the scary thing is that sometimes endometriosis may not cause any symptoms and women may simply not know that they have it. It's believed that quite a lot of women who are diagnosed with unexplained infertility may actually be suffering from endometriosis. But an ultrasound scan isn't the definitive way to diagnose it. It can help to give us clues, but really and truly the only way to know whether you have endometriosis or not is if you have a laparoscopy or keyhole surgery that's able to look inside the tummy, take some of the tissue from there, send them off for a look under a microscope, and then categorically see if that tissue is endometriotic or not. However, that doesn't mean to say that every woman who's got this condition needs to have a laparoscopy. And this is where it gets a little bit complicated. So depending on the symptoms that you've got and how long it's taken you to get pregnant, your doctor or specialist may or may not refer you for potential surgery. And it's really important that this discussion is done with all of the other details and benefits of your history that are taken into account. But this doesn't mean that an operation or a laparoscopy is appropriate for everyone. And this must absolutely be discussed with your specialist. This is because it all depends on the symptoms that you're having. It all depends on the age and also how long it's taking you to get pregnant. And a doctor will take all of this into account as well as your general state of health and history before making a decision as to whether they feel an operation might benefit you or not. There are also risks that are present with any operation that you do, and these have to be taken into account as well. So it's always a question of weighing up the pros and cons, the advantages and disadvantages of doing something before a decision is made or recommended to you. The good news, however, is that you can do a lot of things to try and help yourself. And I've gone through some of these in terms of the food in particular that you should be eating to try and help a condition like endometriosis. And I've got a video on this under my nutrition section on the website if you have a look and click under there. So I hope that's really beneficial to you. As well as being mindful of what you eat, it's really important that you also exercise and take your fitness into account. And this again is important for endometriosis because fitness and doing exercises can help to boost circulation around the ovaries and around the lining of the womb. So it's generally good for anyone who's trying to conceive, but also particularly good in patients who've got endometriosis. So have a look at that and the tips I've given you under my fitness section of the website. Good luck with that. Please let me know your thoughts and leave me any questions that you might have, and I'll try and make a video looking at all those other questions in the near future. Sometimes alternative complementary therapies can help, so that's things like acupuncture, for example. They can help to stimulate the energy flow within the body and also improve circulation, a bit like exercise can, improving the blood flow to the actual endometrium or the lining of the womb. So do see if you want to give that a go. There's more information on that on my website.